Okay. So my next question is to Dr. Geelani, sir. Dr. Geelani, it is, as you said earlier also, the disease comes with the passage of time. It's an insidious process spanning over decades and years, right? And you said that young people are also vulnerable. So is the progression of the disease, the trajectory of disease progression, is it the same in older people or is it different in younger people? How does the disease develop and what kind of course does it take in older and younger people?
Yes, it is a very important question. And it is said about the coronary artery disease or in fact you can say about any other arteries also, because there are many arteries of the body. And when this body, like the arteries which are supplying to the heart, what we are talking about today, there are other arteries which are supplying to the other vital organs. So like to the brain, if they can also develop blockage, they can also have the brain stroke. These vessels are also, the kidneys are also vital organ. If they are also supplied by the blood, and if their supply is also blocked, they will also have. So this progression of the disease is not only for the heart, it is for the whole body, even into the leg also. The leg arteries are also involved. You may find that the person is having leg pains without any reason, and he is not able to walk. If he walks, he develops pain, and then after the leg pain, there may be some blackish discoloration. So what I mean to say, because this vessels, it can involve the other organs also. It is not all alone only for the heart. So the person has to be very careful. If they are having the other symptoms to the other part, that will also give a clue. Yes, this patient is having some coronary artery disease, and his coronary artery disease may also be developing. So that is one important thing. And like after 60 years, if you do the angiogram after 60 years, you will find invariably almost more than 50% people will have some of the blockage. May not be significant enough, but they will be having some blockage. So it is said that if it is above 60, it is not the fault of the person. If the coronary artery disease is occurring below 60 years, yes, it is because of the fault of the person or the fault of his ancestors. Right. So this we have to see.
Right.
We should know.
Right.
As I have already mentioned that the course in these two subgroups, younger group and the older group, are entirely different.
Right.
It is very slow and insidious. Like if the 60%, if the person is more than 60% and he develops blockage of around 60 to 70%, it is very harmless. It will take another 10 to 20 years to develop it into 100%. If he is taking medicine and other precautions. But the same disease, if it occurs in a younger, like 30 years, 35 years, this disease will progress very fast.
Right.
And this person will land up in having 100% blockage from 60% or 50%. It will land up into 100% within a period of 5 to 10 years itself. In spite of taking medicine, in spite of taking precaution. So one has to be very careful in this because the course is very aggressive and it is very, we can call it a malignant course. It is not only aggressive, it is a very malignant course. So this patient, the younger the person, the disease is very dangerous in them, like in the elderly person.
So sir, you've signposted two very important points for us. One, that the progression of disease in younger people who have suffered from CAD, it's very dangerous, it's very fast, it's very aggressive, and they need to be more watchful because the blockage of arteries is going to not take that many years, as opposed to older people who develop CAD. The course of the blockage and narrowing of arteries may take several decades for them. Right. The second thing, sir, which you said, which I want to highlight for my viewers, is that the process of the blocking and narrowing of arteries pertains not just to coronary arteries. You said that even the other arteries which supply blood to the brain or to other vital organs of the human body, they also suffer from the same process. So one has to be watchful not only about coronary arteries, but the process of atherosclerosis affects arteries supplying blood to the other organs of the body also. It's an extremely important point for our viewers to pay attention to.